Hello everyone, welcome back to my YouTube channel, and today our topic is mother and baby. And in this video we will discuss all the basic things that are related to pregnancy, mother, and this is the lecture 1. It contains all the basic terms and MCQs. At last we will discuss MCQs related to this. In this video we will discuss about gestational age, trimesters, para, gravida, and how to solve this MCQ. So first we will start about the gestational pregnancy duration. So what is basically the pregnancy duration? If we talk about pregnancy duration, it is talked in two perspectives. Number one is gestational age and number two is fetal age. So the gestational age is 40 weeks while the fetal age is 38 weeks. The gestational age is the number of completed weeks of what? Pregnancy. The number of completed weeks of pregnancy which are counting from first day of last menstrual cycle. These are counted from first day of last menstrual cycle. While if we talk about fetal age in case of pregnancy duration, it is the counting from estimated date of conception. It is counted from date of conception, and as we already know, the ovulation occurs after 2 weeks of menstrual cycle. So fetal age is less than gestational age, 2 weeks less than gestational age. So this is all clear about gestational age and fetal age and why fetal age is less than gestational age. Now we'll talk about trimesters. What are the trimesters? Tri means 3 and mesters. So pregnancies are divided, 40 weeks of pregnancy is divided into 3 durations. And if we divide 3 equal durations, that is 13 week. If we divide 40 by 3, it is 13. So we take first 13 weeks of the pregnancy as first trimester, second 13 weeks of the pregnancy as second trimester, and and the last 13 weeks of the pregnancy as third trimester. Now it is very easy to remember. We divide 40 weeks into 3 equal 13 weeks and name them respectively as first trimester, second trimester, and third trimester. So this is all clear. You have all cleared about it. Now move on to the next thing. Gravida and para, and what are preterm, term, and post-term babies. So first talk about the basic thing. What is preterm baby? Pregnancies who have reached 20 weeks but ended before 37 weeks are preterm. So why we have talked about here about 20 weeks in preterm? Why we have talked about 20 weeks is that 20 is the half gestational age. Okay, so if the pregnancy has reached its half gestational age but ended before 37 weeks, it is preterm. If the pregnancies have lasted about 37 to 42 weeks, it is full term. And if the pregnancy go beyond 42 weeks, it is post term. Okay, now let's talk about gravida and para. Gravida or gravidity or para or paridity. Gravida is the total number of pregnancies a woman have. Okay, and para is the number of pregnancies that have reached 20 weeks of gestation. So gravida it includes the number of present children or present pregnancy. It also includes miscarriages or abortions. Gravida includes miscarriages and abortions. So there is a trick to remember gravida. G for gravida and G for grave. So you have to include all the babies that are in grave. So gravida. And in para there are the number of pregnancies that reach 20 weeks of gestation. It includes alive babies as well as stillborn babies. Now we move towards the other thing. GTPAL. You have to remember one thing. GTPAL, acronym for the pregnancy outcome. When if you have ever worked in MCH or labor rooms or gynae area, you must have listened this thing. GP. Some people say it GP. GP for gravida and para. Now mostly people use this GP, gravida and para, but in some areas GTPAL is used. So GTPAL is G for Gravida, T for term babies, P for preterm. Gravida, term, preterm, abortions, A for abortions, and L for living children. And we will see here what this all means. As I have told you all about Gravida is total number of pregnancies. Okay, G for Gravida and G for grave. So think of a babies that are present in living world as well as in grave. So it includes the total number of pregnancies and total number of miscarriages and abortions. And one thing you have to remember, this in all these scenarios is twins and triplets are counted as once because it is only one number of pregnancies. It includes number of pregnancies, not number of children. So twins and triplets are included as counted as one. So gravida means number of pregnancies. The other thing is term birth. As the name indicates, terms means the newborn that are birthed at full term, that is more than 37 weeks of gestation. It also includes alive or stillborns, and in this twins and triplets are counted as one. The next is preterm. Preterm babies, as the name indicates, preterm. Preterm are the babies that are delivered within 20th to 36th or 37th week of gestation, and it also include stillborn or alive, and in this triplets are counted as one. Remember one thing in gravida remember one thing in gravida, term babies and preterm babies, twins triplets are counted as ones, and in all these we include alive and stillborn. We will always include alive and stillborns in all these three. Okay, now let's move towards the abortions and miscarriages. Abortions and miscarriages, in which in this you have to remember 20 weeks of gestation. The number of pregnancies delivered before 20 weeks means half of gestation. Before half of gestations, it is abortion, and it counts gravida. In this, twins and triplets are counted as ones, and living children are the number of current living children. In this, twins and triplets are counted as individually. Only in this case, in living children, twins and triplets are counted individually, while in any other case these are not counted as individually, they are counted as one. Practice question number 1. You are admitting a client to mother baby unit. 2 hours ago, she delivered a boy on her due date. Boy on her due date. This is the main thing. She gives her obstetric history as follows. She has 3-year-old daughter, 3-year-old daughter who delivered a week past her due date. Means this is a full term baby. And she delivered a full term baby boy. She delivered a full term baby girl 3 years ago, and she had a miscarriage 8 weeks gestation, and she had a miscarriage 8 weeks gestation means she had one miscarriage and two full term babies. So what is GTPAL? G means gravida, G means gravida. So her gravida is 3. Gravida includes all the number of pregnancies. Number 1, she has a boy, second girl, and third miscarriage. So gravida is 3. Gravida is 3. And T. T means term babies. So she has two term babies, a boy and a girl. So number second is 2. P. P means preterm baby. Is she have any preterm baby? No, she haven't any preterm baby delivered. A for abortion, and is she have any abortion? Yes, she has one abortion, 8 weeks gestation, at the age of 8 week gestation. So this will be 1. And L. L for living children. She has two living children, a boy and a girl, 2. So the correct answer will be D, option D, 32012. You have to solve this second practice question and answer this second practice question in the comment box. So this was all about today's